Hi, Mr. Roper. I'm
Hello.
Kate. I'm going to be your physical therapist today. How are you?
I'm fine. How are you, Kate?
Good. It's good to meet you.
Nice to meet you as well.
Okay, so first I need to know a little bit about your medical history. So I'm going to ask you a lot of questions today just to get an overview of what we're working with and how we're going to treat you, okay?
Okay.
Can you tell me your date of birth?
7/1/52.
And your height and weight?
6'3", 245.
All right. And what do you do for an occupation?
I'm a drummer.
Drummer. All right. And your physician is?
Lou Stevens.
Dr. Lou Stevens. All right. Do you do any regular forms of exercise, activities?
Other than working around the farm, nothing, no treadmill stuff.
No trips to the gym.
No,
All right. And how often would you say you work around the farm?
every day,
Every day, 7 days a week.
pretty much.
All right. So tell me a little bit about what brought you to physical therapy today.
Well, my low back
Mm-hmm.
is hurts 100% of the time.
100% of the time. Can you?
I'm not very flexible,
Okay.
so I have a ruptured disc and another leaky disc in my low back.
Okay.
I also have several bad discs in my neck.
Okay. So you have neck pain. Can you, if you lean up a little bit, can you show me on your back? Maybe point to the
My
areas
back,
where it hurts.
L4, L5.
L4, L5.
Yeah,
Makes it easy.
yeah.
So pain on L4, L5, and all over low back pain. And is that the only place you have any pain? Is there anywhere else?
In my neck.
In your neck? And does it just stay in your neck? Does it go to your shoulders, down your arms?
Sometimes it goes to my shoulders.
Sometimes it goes to your shoulders, both
Yeah.
shoulders?
Yep.
Both
I've had
shoulders.
both shoulders operated on.
Okay. So it's on both sides. Do you have any numbness, tingling?
No.
All right. When your back pain is at its worst, on a scale of 0 to 10, what would you rate it? 0
At
being
its worst?
when it's at its worst. 10 is like emergency room pain, and 0 is no pain at all.
Okay, 8.5.
8.5. And when it's at its best, what would you rate the pain?
3.
3. And what is it right now?
Out of 3.
Out of 3. So it's not too bad today.
Well, I'm not doing anything.
Right. For your neck pain, is that the same ratings, or what would you rate it at its worst?
At its worst?
Mm-hmm.
At its worst, it's a 8.5 or 9. Basically, in certain positions, it triggers it, and I have to. If I stay in that position, I'm going to the ER, so I have to move to get rid of the pain.
Okay. At its best, what would you rate it? When
3.
3. And what is it right now?
Well, 3.
About a 3.
Yeah.
Okay. So right now, sitting here today, where do you feel the most pain?
Right now, in my neck.
In your neck. In a 24-hour time period, from the beginning of your day until the next morning, when would you say your pain is at its worst? Is there any time of day that it's it is?
Early evening.
Okay. Are your symptoms present 24 hours a day, or are they always there?
Yes.
Okay. And in the early evening, where are those symptoms that are the worst?
Low back.
Back. Is that after you've been up and around all day?
Yeah.
Okay.
The more I do, the worse it is.
Do you ever feel like there are positions that you get into with your low back that cause your low back pain to be aggravated?
Oh, yeah.
What are those positions?
Any position that, that causes me to use my low back for a balance point. For instance, working on my knees, working with my hands on my knees is pretty much a 30 seconds and then it's over. I can't do anymore. So anything that makes my low back the pivot point.
Okay. So if you bend over to touch the ground, does that hurt?
Yeah, but it hurts worse to bend slightly and then hold that position.
And hold that position. Okay. What about your neck pain? What positions make your neck pain worse?
Anytime I'm laying down trying to work on something with my neck cocked, I better fix it quick.
Better fix it quick.
So it's painful.
Okay. So if you're laying down and your neck is cocked like this and you're working on something, are there any other positions where your neck pain is just excruciating?
No, that's the main
That's
one.
it? Okay. So other than changing the position, are there any things that you do that, like any activities that you do that help you feel better, or any medicines you might take?
Yeah, the activity of taking a lower tab is
Pretty good.
yeah, it's pretty effective.
Pretty effective. Okay. And changing positions.
By the way,
Mhm.
on the other sheet, I didn't tell you that I have numbness in my toes.
Numbness in your toes? Just
Mhm.
in your toes?
Mm-hmm.
Are there any are there all of your toes or just any certain toes?
No, not the big toe. The last three, particularly on the left foot.
Okay. Thank you. So, back to your symptoms. You said your symptoms are worse in the early evening after you've been working all day? And that's for your low back and your neck?
Mm-hmm.
Okay. Are there any other times a day when you feel really, then you can really tell your symptoms are there?
It just
First thing
depends
in the
on
morning?
what I'm trying to do. Yeah, first thing in the morning is pretty, can be pretty bad.
And when would you say that this low back pain and this neck pain started?
In the 9th grade.
In the 9th grade?
Mm-hmm.
Okay, so that would be 9th grade. What happened to cause it?
I total lost a car.
Okay, tell me more about it.
Okay. I was speed shifting in a curve and slid off the road and knocked down 2 pine trees. And
Nice.
yeah, it was great.
So were you hospitalized? Did you have any injuries?
Well,
Other than
I didn't go
causing
to the
this?
hospital. Nothing was broken.
No hospital. Okay. But you've been able to tell ever since then that
Mm-hmm.
something's definitely not right?
Yeah.
Okay.
Then about 7 or 8 years later, I T-boned a car with a motorcycle.
Okay.
T-bone.
Right. Still the same thing, no hospital?
Yeah, I went to the
You
hospital
did
that
go to the
time,
hospital.
but nothing broken.
Okay.
Just flew through the air
Nothing broken when you flew through the air.
and it landed on the other side of the car.
Nothing broke.
Nope.
Superman. So how many other times have you had similar problems?
Similar problems. You mean like accidents, or are you asking problems?
How many other
Oh.
times have you had similar problems like this, or has it just been an ongoing thing since 9th grade?
Yeah, pretty much.
Ongoing? Okay. How would you say your symptoms are right now? Are they changing, getting better, getting worse,
Sitting
more
here?
frequently?
No,
this period of time in your life?
okay. They get progressively worse.
Progressively worse.
Yeah.
So you'd say it all started in ninth grade and it's just gotten worse over time.
That's right.
Okay. What other healthcare professionals have you seen about this current problem?
You want names?
Sure.
Phil Milner,
And what kind of doctor is he?
he's an orthopedic surgeon.
Okay.
He operated on both my shoulders.
And any other healthcare professionals other than Dr. Milner?
Dr. Logan.
Another ortho?
Mm-hmm.
All right.
His mentor was Dr. I'm trying to think of the name. I can't remember his name.
Grizz?
No, he's in Greenville. He was the teacher for when Logan was an intern. I
Okay.
guess. Starts with a K. Say Cade, not a K. Anyway, saw him about my low back. Have seen various chiropractors. Had a rhizotomy. I don't remember that doctor's name either.
All right. So you've seen Dr. Milner, Dr. Logging, Dr. Logging's mentor, chiropractors, and then a doctor who performed a rhizotomy. Have you seen any doctors other than that about the symptoms associated with your low back?
Dr. Iswanik in Charlotte years ago. That was with my neck.
Okay. Now we're going to talk about some tests you might have had done for diagnosis purposes. Have you had any MRIs?
Mm-hmm.
You have. Have you had any x-rays?
Mm-hmm.
Have you had any myelograms?
Not that
No.
I'm aware of.
Have you had any EMG or nerve testing?
Mm-hmm.
Yes. And are there any other tests you can think of that you've had that I didn't ask?
No.
As far as treatment of your symptoms goes, I'm going to ask you a few questions about what you've had done to help your symptoms feel better. Have you had any injections?
Mm-hmm. Oh yeah, I forgot about that guy.
Who was he?
Dr. Satterthwaite.
Dr. Satterthwaite. And what did he do?
He does epidural type injections.
Okay. Epidural injections. All right. Have you tried any exercises to help you with your low back and neck pain?
Mm-hmm.
You have. Cold or heat?
Mm-hmm.
Have you had a brace or any type of support?
No.
No. Have you had massage therapy?
Mm-hmm.
Have you had electrical stimulation like the E-stim?
Mm-hmm.
Have you had the ultrasound?
No.
No. Traction machine?
Mm-hmm.
Yep. Manipulations or adjustments? And acupuncture?
No.
No. Have you had anything else that I didn't ask about? Have any of those seemed to help?
Yes.
Yes. Are there any in particular that stand out as that they seem to help more than the others?
No, as this condition progressed, eventually chiropractic became less helpful. The injections worked great at first, then they became less helpful.
So things helped, but then they quit helping, basically?
Mm-hmm.
Okay.
The rhizotomy lasted for about a month. So I really didn't bother to get another one.
Right. Do you feel that your current problem is getting better or getting worse? You said that you thought it was getting progressively worse, right?
Oh, yeah, it's
Progressively
degenerative.
worse.
Degenerative disc disease and herniated discs.
Right. What tasks or activities for work do you think are impacted other than when you're having to lay on your side and cock your head or when you're having to sit with your back at an angle on your knees?
Pretty much anything.
Pretty much anything? What can you not do? Other than the hinging motions and the laying and working on something with your head cocked.
You know, I can't lift much weight. In other words, I'm still physically able, but I know better because, you know, I'll pay for it that night.
Right.
I'm limited as to how long I can ride my tractor, ride a motorcycle, etc. About 30 minutes and, you know, I have to come off of it.
Okay. Are there any social, recreational activities that you can't do or that are impacted because of your condition?
Yep, haven't hit a golf ball in almost 7 years because of,
The pain.
yep.
Okay. What about at home and at work? You say you work on the farm and you said that the tractor is hard for you to ride on and the motorcycle's hard. What about around the house? Are there things you can't do around the house? Or do you just kind of find a way to do them?
I don't do that much around. Inside the house, you mean? You know, around the house, outside, you know. There are no activities I can do that don't impact my low back.
Okay.
Brushing my teeth and washing my face hurts my low back.
Right. Speaking of your home, what kind of support system do you have at home? Who do you live with?
My wife.
Your wife. Is she pretty able to do stuff?
Yes.
She is. So she can help you do what you can't do, and then you can help her.
Mm-hmm.
Right?
Okay. We'll go with that.
All right. Have you taken any steroids or anticoagulants? Any blood thinners?
No.
No. And when was your last physical exam?
In the last 3 months.
Okay. Other than your back pain and your neck pain, how is your general health overall?
Great.
Great. Other than that one little thing. Okay. I'm going to ask you a few questions just about your general health overall and your medical history. The symptoms that you're currently experiencing or have recently experienced. Have you recently experienced fever, chills, sweats, night sweats?
No.
No. A weight change of more than 5% over a 4-week period? No. Just a general icky feeling, fatigue, loss of energy?
Sure. I'm 62. Yeah.
I'll put age related.
You know, it's not the new 40.
Right. Any nausea or vomiting?
No.
No. Constipation, diarrhea, change in frequency, numbness, tingling
My toes.
in your toes and those 3 toes on the left.
Mm-hmm.
Weakness,
No.
no. Passing out or dropping to the ground.
No.
No. Dizziness, night pain, shortness of breath. Change in volume or control of urination, change in urinary frequency, sexual dysfunction, difficulty swallowing, any of those?
No.
No. Do you use tobacco?
No.
Do you use alcohol?
No.
And so I have a list of your previous surgeries. Are you currently seeing or have you recently seen any of the following? A medical doctor other than Dr. Stevens?
Other than Dr. Stevens, Well, it's been a while. I've seen a urologist.
A neurologist?
Yeah.
Okay. Have you seen an osteopath, a dentist, psychiatrist, physical therapist, or chiropractor? You said you have seen a chiropractor, but
Mhm.
was that recent?
I did go recently. Yeah.
Recently? A physical therapist or a psychiatrist or a dentist?
Dentist.
Dentist. Just routine. Routine's gonna work. Alright, and then one last little form for us to fill out together. I'm going to go through a list of different diseases, disorders, conditions, and I need to know if anybody in your family, including you, has had them.
Okay.
Diabetes?
No.
Nope. Tuberculosis?
No.
Heart disease?
Yes.
Yes. Who?
My mother.
Mother. High blood pressure?
Yes.
Who?
My mother.
And stroke?
You know, how far back are we going here?
Mother, brother, father, sister, son, or daughter?
No.
No. Kidney disease?
No.
Cancer?
Yes.
Who?
My mother.
Arthritis?
We include me in this?
Mm-hmm.
Yes.
Anemia?
No.
Headaches?
No.
Epilepsy?
No.
Mental illness or depression?
No. Did you say epilepsy, daughter?
Mm-hmm.
Yeah.
Okay.
Yes, you would call it that.
Osteoporosis? Okay. And I just need to know any medications or drugs, dietary supplements that you're taking, prescription or over the counter.
I take a multivitamin, Flexeril, Zoloft.
Do you know how much Flexeril you take, the dosage?
It's hard for me to remember
Okay.
whether it's, like a half of a person, you know. 10 milligram
Okay.
Flexeril.
And
That might be like 100 times too much. I'm thinking it's a 10. It may be 0.10 or something like that. I'm not sure.
how often do you take a Flexeril?
Every day,
Every day? And how long have you been taking that?
for longer than I can remember.
Okay. And you said you also take Zoloft?
Yes.
Do you know the dosage of that?
50
50? Okay. And how often do you take that?
every day.
Every day? And how long have you been taking that?
15 years maybe.
15 years?
10, 15.
Okay. Other than the multivitamin, the Flexeril, and the Zoloft, are there any medicines I should know about?
Mm-hmm.
Okay.
Celebrex.
Celebrex. And do you know how much of that you take?
200.
Every day?
Mm-hmm.
Every day.
Once a day. They're all once a day.
Okay. And how long have you been taking Celebrex?
15 years.
Okay. And any other medicines?
Mm-hmm.
Okay.
Nexium.
Nexium. The amount, dosage? Do you
Not
know?
sure what that
Not
is.
sure. And you take that one every day as well?
Mm-hmm.
And how long have you been taking that?
5 years.
Approximately 5 years. Okay. And are there any other medicines I should know about?
Lortab.
Lortab. Do you know the dosage of that you take?
10.
You take that how often?
Typically once a day. Occasionally more, but most of the time once.
And how long have you been taking that?
3 years.
Any other medicines I should know about?
I think that's enough.
Think that's it?
Yeah.
All right, well, I think we have enough, so now we'll proceed with your physical exam.
Okay.